thyroid artery is supplied by superior and inferior thyroid arteries. thyroid artery thyroid gland को superior और inferior thyroid artery supply करती है. कौन कौन सी करती है? superior or inferior thyroid artery. The superior thyroid artery is the first anterior branch of external carotid artery. Superior thyroid artery first branch है first anterior branch है external carotid artery की. It runs downwards and forwards and intimate relation to the external laryngeal nerve. It runs downwards and forward in intimate relation to the external laryngeal nerve. After giving branches to the adjacent structure, the artery passes the pretracheal fascia to reach the apex of the lobe. ये पास करती है pretracheal fascia को और ताकि और कर सके apex of the lobe where the nerve deviates medially. यहाँ पे ये medially deviate कर जाती है. Bismillahirrahmanirrahim. Superior thyroid artery is the first anterior branch of external carotid artery. It runs downwards and forwards in intimate relation to the external laryngeal nerve. It gives branches to the adjacent structures and passes the pretracheal fascia to reach the apex of the lobe where the nerve deviates medially. At the upper pole, the artery divides into anterior and posterior. At the upper pole, the artery divides into anterior and posterior branches. At the upper pole, the artery divides into anterior and posterior branches. At the upper pole, the artery divides into anterior and posterior branches. At the upper pole, the artery divides into anterior and posterior branches. Superior and inferior thyroid artery. Superior and inferior thyroid artery branch. It runs downwards in forwards and passes the pretracheal fascia. Reach the apex of the lobe and the upper pole, the artery divides into anterior and posterior branches. Superior and inferior thyroid artery branch runs, passes, reach and divides. The anterior branch descends on the anterior border of the lobe and continues along the upper border of the isthmus to anastomose with its fellow opposite side. The anterior branch divides into anterior and posterior branches, and the anterior branch descends on the anterior border of the lobe and the anterior branch descends on the anterior border of the lobe and continues along the posterior border, continues along the upper border of the isthmus to the anastomose with its fellow of the opposite side. Anterior branch descends on the anterior border of the lobe and continues along the upper border of the lobe to reach to anastomose with its fellow of the opposite side. So what will happen? The anterior branch will descend on the anterior border of the lobe and continues along the upper border of the isthmus to anastomose with its fellow opposite side. The anterior branch descends on the anterior border of the lobe and continues along the posterior upper border of the isthmus to reach the to anastomose with its fellow opposite side. So what will happen? Anterior branch will descend on the anterior border of the lobe. Anterior branch will descend on the anterior border of the lobe and continues and descends on the anterior branch descends on the anterior border of the lobe and continues along the upper border of the isthmus to anastomose with its fellow opposite side. The anterior branch descends on the anterior border of the lobe to anastomose with anterior border of the lobe and continues along the upper border of the lobe isthmus to anastomose with its fellow opposite side. The anterior branch descends on the anterior border of the lobe then continues along the upper border of the isthmus to anastomose with its fellow opposite side. The anterior branch descends on the anterior border of the lobe to and continues. The anterior branch descends on the anterior border of the lobe and continues along the upper border of the isthmus to anastomose with its fellow opposite side. The anterior branch descends on the एंटीरियर ब्रांच सो क्या होगा कि एंटीरियर ब्रांच डिसेंड करेगी एंटीरियर बॉर्डर ऑफ द लोब एंड कंटिन्यू करेगी along the upper border of the isthmus to anastomose with its fellow of the opposite. The posterior branch descends on the posterior border of the lobe and anastomose with the ascending branch of the inferior thyroid artery. The posterior branch descends on the posterior border of the lobe and anastomoses with the ascending branch of the inferior thyroid artery. The posterior branch descends on the posterior border of the lobe and anastomoses with the ascending branch of the inferior thyroid artery. The posterior branch descends on the posterior border of the lobe and anastomoses. The posterior branch descends on the posterior border of the lobe and anastomoses with the ascending branch of the inferior thyroid artery. The posterior branch descends on the posterior border of the lobe and anastomoses with the ascending branch of the inferior thyroid artery. Posterior branch क्या होगा कि वो डिसेंड करेगी on the posterior border of the lobe and anastomoses with the ascending branch of the inferior thyroid artery. Posterior branch descend करेगी on the posterior border of the lobe and anastomoses with the ascending branch of the inferior thyroid artery. Posterior branch descends on the posterior border of the lobe and anastomoses with the ascending branch of the inferior thyroid artery. Posterior branch descends on the posterior border of the lobe and anastomose with the ascending branch of the inferior thyroid artery. Posterior branch descend करेगी on the posterior border of the lobe and anastomose करेगी. Anastomose with the ascending branch of the inferior thyroid artery. Anastomose with the ascending branch of the inferior thyroid artery. Posterior branch हमने इसमें ये पर दो चीज़ें करेगी. Posterior branch descends on the posterior border of the lobe and anastomose with the ascending branch of the inferior thyroid artery. Anastomose with the ascending branch of the inferior thyroid artery. Which is fellow of the upper anastomose with the ascending branch of the inferior thyroid artery. Anastomose with the ascending branch of the inferior thyroid artery. So we have two branches, anterior branch and posterior branch. Anterior branch will descend on the anterior border of the lobe and continues along the upper border of the isthmus to anastomose with its fellow of the opposite side. A posterior branch descends on the posterior border of the lobe and anastomose with the ascending branch of the inferior thyroid artery. Anastomose with the ascending branch of the inferior thyroid artery. Anastomose with the ascending branch of the inferior anastomose with the ascending branch of the inferior thyroid artery. So we have studied the arterial. We are studying about the arterial supply of the thyroid gland. The thyroid gland is supplied by the superior and inferior thyroid arteries. The superior thyroid artery is the first. Superior thyroid artery is what is the first anterior branch of the external carotid artery. It runs downwards and forwards in intimate relation to the external laryngeal nerve. After giving branches to the adjacent structure, the artery passes the pretracheal fascia to reach the artery passes the pretracheal fascia to reach the apex of the lobe, where the nerve deviates medially at the upper border or the upper pole of the artery. Passes the pretracheal fascia to reach the